I am Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Orthopedic Surgeon. Today we are going to discuss common cause is low back pain or a pain dragging down to the limbs. Usually back is consisting of 5 vertebral bodies and 1 sacral bone which consists of 5 bones. Where these bones, inside the bone will have a canal and then body and the spinous process and the bone joints. Through the canal there is a nerve, spinal cord passes, where each vertebra sends out 2 spinal nerve roots. These are yellow colored are the nerve roots which are coming from the spinal cord, and there is a disc which act like a shock absorber in the vertebral body. So what we should know why there is back pain common in human beings. This is most mobile part in our body, where more than 60% of the weight is above the low back area, only 30% weight below the low back area. So when there is a flexion extension movement activity takes every second, either back bend or front forward bend and bend sideways. This sort of a movements will leads to certain problems. Likewise, when there is a bone quality is poor, there will be pathological problems. When there is a disc injury or disc bulge or disc prolapse, there will be a nerve pressure problem. When there is a bone tumors, in the bone, there will be a pathological fractures or a different type of pressures on the certain organs, whether it could be malignant or benign. When there is a osteoporosis, like less bone mineralization leads to osteoporotic fractures or wedge compression fractures. When there is a degenerative changes or arthritic changes in these joints leads to certain arthritis problem like spondylitis. When there is a degenerative changes due to vitamin D deficiency in calcium, these leads to a degenerative changes in the bones called spondylosis. When there is a sacralization, a lumbar vertebrae fused to the sacrum is a problem in the low back pain. There is a possibility of spondylolisthesis, is otherwise called a forward bending of one vertebra over the another vertebra. If the forward bending of L4 vertebra over the L5 or L5 vertebra over the S1 is common, where that is the listhesis, otherwise 25, 50, 75, 100% levels of 1, 2, 3, 4 grades will be forward displaced. So such time then there will be a compression on the spinal cord or the roots lead to certain problems or back pain. When there is a tumors in the bones, like it's a bone malignant tumor or benign tumor, also lead to the pain in the back. There is an infectious reason where tuberculosis also causes the TB, otherwise causes the back pain. And the bacterial infection also causes the back pain. And then where there is a injuries to the spinal and then the vertebral body. There will be a violent road traffic accidents also causes the fractures in the major bones, as well as it transects the spinal cord, lead to paraparesis in the lower limbs. So these are the common injuries and common diseases which leads to back pain among the spinal cord in the lower back area and the sacral area.